hear a lot of patients tell me that, people tell me that, oh, ortho wasn't an option or Invisalign wasn't an option, and they feel really down about it, and they're just like, I've just kind of accepted my smile for the way that it is. And with Invisalign in our office, what I love to do is I love to scan them because every patient gets a scan, so we get to see where their teeth are at. And then what we always do is we like to put it in the Invisalign outcome simulator so that they can see what is possible, right? I'm not saying that that's going to be, the end all treatment at the end of the day, but what is possible, right? I think that, asking the patient what their goals are before we even start treatment, that's the first step, right? I mean, if we can achieve at least something close, then hey, you know what? That's great, right? And as long as the patient knows, we've done our job to let them know, hey, we can get you close. Maybe we can't get there all the way, but you can still get close. So that's what we do at our office to make sure that patients feel comfortable with their Invisalign treatment. Some of the unexpected benefits of Invisalign actually is not only do you get a straighter smile, but because your teeth are in the right spot, actually, your teeth are going to be less prone to wear. So many people clench and grind their teeth a lot. And so, if your teeth are in the right spot, the wear won't be on just a couple specific teeth and then a couple specific teeth are really worn down, right? So it really evens out your bite. And then also when your teeth are in the correct position, now you're actually able to clean those teeth properly, right? And so a lot of times if your teeth are really crowded, and we see this all the time, many people have it where their bottom teeth are maybe a little bit kind of zigzagging a little bit maybe. It's really hard to floss, right? Sometimes it's almost impossible to floss. And so being able to get the floss in there properly as well as brushing, it's just going to make it way healthier. So I would say your gum health is going to be really healthy and really good, and then your tooth health is going to increase because your teeth are in the right spot. In our office at Pak Dental, we do expect our patients to wear their Invisalign trays for 22 hours a day, so the majority of your day, except when you're eating. And the reason we expect that is because we want your teeth to go to the right spot, right? And so I'll always tell you that if you don't wear it for 22 hours a day, at least, your teeth aren't going to move. And what's going to end up happening is you're going to have to do more refinements, you're going to have to do more treatment, you're going to be in Invisalign longer, and at the end of the day, it's going to be more inconvenient for you to do that, right? So I always encourage my patients, just wear them. I know it's not comfortable at the beginning, but eventually it will be comfortable and your brain, you won't even think about it anymore. And we also make it really easy at our office. We give all of the trays to you at the beginning of treatment, and we do virtual care. So we're trying to make it as easy for our working professionals, our moms, our dads, anyone, so you don't have to come into your appointments, very often. All that I ask is that you wear your trays for 22 hours a day, and hopefully I'll see you at the end. That's it. Virtual care is essentially an app on your phone. It's the Invisalign app, and yes, it is less appointments. And the reason we do that is for your convenience as a patient. The virtual care app, what it does is it basically has like all kinds of tracking stuff. We give you this thing called the Invisalign lens that you attach to your phone, and then you're actually going to use it. Your phone's going to tell you, the app's going to tell you what photos to take with the Invisalign retainers and trays in, right? And what that does is it just creates less appointments for you, makes it more convenient. It doesn't mean that I'm not going to see you if you want to be seen, but what it's doing is it's making more convenient for you. What we're doing is we're utilizing AI technology, we're using the pictures, and we're using all this kind of stuff so that it can be easier for you at the end of the day. And so all I'll do is I'll log into my app about once a week. You've changed out your trays, you sent me your pictures, and then I say, thumbs up, you're good to go. In our office, we help our patients, all patients, nervous patients included, to visualize where their teeth possibly can go. So the beautiful thing about the iTero, which we've intentionally gone with Invisalign, is that it has an awesome technology called Invisalign Outcome Simulator. So you get to see where your teeth can possibly go to, and that allows us to kind of like show you like, hey, like this is what's possible. It might take X amount of months, it might take, whatever amount of time, but we'll get it done. It's just a matter of, getting there. And you know what? Maybe this Invisalign Outcome Simulator, what it's showing you is not the exact result that you're going to get, but it's going to be close, right? And if you want your teeth to be at least a decent amount straighter and better and in just a healthier spot, then that's how we do it. We show you it on your Invisalign outcome simulator, and then you're going to get a great result. So a lot of my patients will ask about, and want to be reassured about what polishing between the teeth is, or they might even have questions about, is Invisalign going to hurt? And you might have some level of soreness when you're wearing your Invisalign trays, especially at the beginning, because what we're doing is we're actually activating the different cells that are inside your bone that are going to take away bone and add bone. And so, it's almost kind of like a little bit of an inflammatory process, kind of moving some stuff. But, it's okay that that discomfort and that level like pain, minor pain that you might feel at the beginning, it does go away, and you won't even notice it after maybe one or two sets of trays. We are polishing between the teeth, and it might be anywhere from 0.1 to 0.5 millimeters. Now, if you look at 0.1 millimeter, you can't even see it. It's almost impossible to see. I don't even have a measurement tool for 0.3 millimeters. So I just want to say that, like, if you're worried about the polishing between the teeth, don't be worried, because the amount of tooth structure we're taking away, it's like almost nothing. You really will never see it.